welcome to Path Made Easy. Today's video is on hereditary hypophosphatemic rickets, also known as vitamin D resistant rickets, where there's usually a mutation in the FEX gene which affects the mineralization of bones and teeth. So the common dental manifestations include large pulp chambers, prominent pulp horns, and clefts and fissures in the dentine, such that these teeth often turn non-vital because these cracks in the enamel and dentine allow ingress of bacteria directly down to the pulp. Histologically, they have a few features which are useful for diagnosis, even though the clinical manifestations are quite characteristic as well. So this is a decalcified section. There's just two sections here of an incisor tooth. The first thing I can spot is that it's got a fairly large pulp chamber, obviously going down into the root canal as well. But this pulp currently is vital, and I know that because I can see blood vessels, and there are also odontoblasts lining the pulp chamber. The most striking feature about these teeth is the accumulation of interglobular dentine. So this is a sign that the tooth is not properly mineralized. So these kind of rounded pink blobs are calcospheриtes, and then the areas that are pale pink are areas where the calcification hasn't merged, it hasn't been complete. So this appearance is called interglobular dentine, and as I say, it's a sign of poor mineralization, and that's related to those mutations in the FEX gene. The other thing I can see is when I zoom in, it's not that obvious, but you can see these little micro clefts within the dentine. Okay, there's a bigger crack there, and often these cracks are even more prominent, and they can connect all the way down to the apex of the pulp. If I had a ground section to show you, these cracks would also penetrate through into the enamel as well. But the main thing to look for is this interglobular appearance in the dentine. And unlike dentinogenesis imperfecta, the tubular structure is actually normal. So these are the tubules in the dentine, and you can see they're forming nice straight lines spanning the full thickness of the dentine. So the tubular structure is normal, but the amount of interglobular dentine is abnormal, plus you might find these cracks and microfissures as well. So this was vitamin D resistant rickets, or if you like, hereditary hypophosphatemic rickets. If you enjoyed this video, please don't forget to like and subscribe to our channel, and thank you to Pathogenesis for hosting the images.